Y'all, Dr. Nate here. We are going to go over what to do if you have injured your back lifting a heavy object. All right, so let's jump in. So number one, do not panic. Do not panic. Panic is your enemy in this case. A lot of people, they lift something heavy, they have this severe spasm. Maybe you haven't had this before, maybe you have had it before, and immediately your body and your brain and everything, your whole nervous system goes into this super panic mode. And when we get on high alert like this, it tends to make things worse. We tend to avoid being active and try to rest more, and we're afraid to do things. And this fear can sometimes lead us down a rabbit hole and a path that's really dangerous, moving into surgery, all that type of stuff. So the most important thing is do not panic. Most of the time, I'm not saying all the time, most of the time, these things do not require surgery. They don't require an injection, and they don't require medications. Sometimes over-the-counter non-steroidal anti-inflammatories can be helpful for this. But ultimately, if you tweaked your back lifting something heavy, it doesn't mean you herniated a disc. It doesn't mean you can't lift something heavy ever again. It just means that you tweaked your back, okay? Is this due to it being weak? Maybe. Is this due to doing something you haven't done in a while? Did you not warm up well? There's a lot of different things of why we can develop back pain from lifting heavier objects. Sometimes people bend over and pick up a napkin from the floor or pick up a sock and their back goes out and they get a back spasm. So it's not all about the weight that we're lifting. Sometimes our body just rebels against us for no good reason. So that's number one, don't panic. Number two is to stay moving. You really do want to stay moving if this has happened to you. So that means walking, still going to the gym, still doing exercises, not doing stuff that makes it worse or makes the symptoms way, way worse, but making sure you're staying moving and just trying to get that blood flowing. Because if you just sit and don't do anything and it just stays tight, then it's probably going to stay that way. Not all the time, but people who are more fearful and avoidant of getting back to activities tend to have worse outcomes. So you want to make sure that you're not doing nothing, but that you're trying to get back to activities as soon as possible. This is supported by basically every healthcare body on the planet. So we want to make sure that that's something we're focusing on. So number one, don't panic. Number two, stay moving. Okay. And there are a lot of different ways to stay moving. You can watch another video of mine where I went over that as well, of what that actually means. Number three, it'll get better in about 2 to 6 weeks. In most cases. This is not every case. So if you're watching this and it's been 10 years and you're like, Nathan, mine didn't get better in 2 to 6 weeks. What are you talking about? You're an idiot. Not you being an idiot. I'm an idiot. Oh, anyways. I might just cut that out or just keep it. So when I say it'll get better in 2 to 6 weeks, in most cases, that is what the literature shows us, that if you have a back spasm and it's from lifting something or from twisting in a weird way that maybe you weren't used to, that in most cases, it's going to get better in 2 to 6 weeks. Now, around 40% of people do have a recurrence of this. So there are strategies that we can employ to reduce the risk of that. And the best one we have is to add an exercise into your daily routine. So if you're just going to watch this video and say, I'll just give it 6 weeks, I wouldn't recommend that. I would recommend getting active. Number two, stay moving, because that's going to give you the best bet of not having this happen again, or the severity will be lower, or it'll happen much less frequently. Now, a couple things to look out for, red flags being, let's say you start to develop these symptoms. This is something you should get checked out. So number one is cauda equina syndrome. So that is actually compression of the nerve roots down through the lumbar spine, and so we're looking at like increased neurological symptoms from numbness, tingling, weakness, bowel and bladder changes, so like it gets hard to control going pee and poop, that's a problem. So you want to make sure that if you're developing those symptoms, that you go see your physician immediately. Okay, but barring that, it's probably not something serious. And when I say serious, that is going to require some sort of surgical intervention. Fracture. So if you fell or you have a history of osteoporosis and you lifted something heavy and you heard a crack, then there might be a fracture there. Again, this is not most people. This is a very small percentage of people, but it does happen. So you just want to make sure that that didn't happen. And if you are clear of those, which most people are, it's like less than 2%, then it's probably going to get better. I'm just going to be straight with you. It's probably going to get better if you follow those first 3 principles. Don't panic, stay moving, and trust it'll get better. Okay? As always, get strong, live well. Please let me know what questions you have for me. I'd love to hear from you in the comments. Please like and subscribe if this has been valuable to you. Share this all over with your friends, and I will see you next time.